Hello, thank you for joining. What the purpose of this webinar is to talk about how, as a leader, you can drive your ambulatory surgery center performance in the world of COVID-19. I'm Jeff Peters. I'm the CEO of Surgical Directions and have vast experience in working with hospitals and ambulatory surgery centers, and at the moment are working with several hundred ambulatory surgery centers as they're beginning to adapt to our new world with COVID-19. And healthcare has changed dramatically. Surgeons are seeing a 50% decline in office visits. Elective surgery dropped by over 90% in the past 3 months. And COVID-19 has actually created a crisis, a financial crisis for surgeons, surgical services providers, and ambulatory surgery centers. And what the purpose of today's discussion is to give you some tools that you can use to help you recover and thrive in light of COVID-19. What COVID-19 has basically done is exaggerated and accelerated a lot of trends that have been going on in healthcare. Over the past 10 years, there's been a shift from inpatient to ambulatory surgery, and increasingly, there's a shift from hospital-based ambulatory surgery to freestanding ASC-based ambulatory surgery, which gives providers of ASC a tremendous advantage. But in order to take advantage of this environment, we've got to be very cognitive of a heightened level of safety so we don't put our patients at risk. What we've found is patients that have found to be positive for COVID-19 have a 50% greater likelihood of post-surgical complications, many of them being respiratory. That's got us concerned as healthcare providers, and it's really making patients ask the question, is it safe for me to actually have surgery? Because of it, we need to demonstrate to our surgeons and our patients that we're adding value, that the outcome of having the surgery and coping with this risk is worth it. We've seen an acceleration in patients' comfort with telehealth and virtual care, a movement away from seeking care from a primary care physician in their office. And when there's not the physical experience of a patient interacting with a primary care physician, there's less of a incidence of that primary care physician saying, I think you could benefit by seeing a surgeon. So it's changed the referral pattern for surgery, and it's clearly accelerated the trend of patients acting as a consumer, taking a bigger role in terms of their healthcare conditions. So in light of this, what can we do as ambulatory surgery providers to not only ensure that we survive, but we thrive and we grow our business? Some of the things that we're going to talk about is the increased importance of communicating with surgeons' offices and their patients, creating a safe environment for patients, staff, and physicians, and communicating it. Because of the rise in unemployment and the financial stress the nation is under, we need to evaluate our financial policies, particularly our time of service payments. In order to accommodate the backlog, we need to look at how we can expand the surgical schedule, use this opportunity to grow our volume with existing surgeons that use us, and then try to get more work from splitters or non-splitters. And at the same time that we're growing our volume, using this opportunity to reduce the costs. So we're going to spend a couple of minutes talking about all of this. What's key is that there is communication between your ASC and surgeon's office to facilitate scheduling. It's not just with the surgeon, it's with the surgeon's scheduler to make sure we understand what their priorities are, when the surgeon is available to take additional time that may be outside of their normal block, and to provide them with tools so that they can email the patients as to what is expected. The importance of scheduling a PAT call or appointment at the point that surgery is scheduled is very important. In many cases, you probably don't want to definitively put a patient on the schedule until you've had some discussions with them. How we can provide the patient with tools to understand what's going to go on the day of surgery, how they can take care of themselves before and after surgery is important, and also reminding the patients of their scheduling, telling them what time to report, creating opportunities that you can communicate with the patient directly, understand their fears, and there's always fears when somebody is having surgery, but in light of COVID-19, there's additional concerns, and part of our job is to get the patients to articulate it and at the same time provide them assurance. The pre-certifications are critically important. Many patients were approved for surgery before COVID-19, and those approvals in many cases have expired. So we need to pre-certify them and verify it again. So communication is very important. Equally important is creating a safe environment for our patient, staff, and physicians. Most ASCs are testing for COVID-19 72 hours prior to surgery, and unless they get a test result that the patient is negative, are not putting the patient on the schedule. Making sure that the patient understands that when they get to the ambulatory surgery center, staff will go out to the car and bring them into the center. In many cases, we don't want family to be with that patient prior to surgery. We talked about the importance of PAT, understanding all of the patient's comorbidity and risk factors, explaining to the patient and staff that there's going to be social distancing. We need to set up our pre-surgical area so there's 6 feet between patients. We want 6 feet in recovery, and we typically want to minimize the number of staff interacting with patients. So that requires that the same nurse that admitted the patient probably would recover the patient. Limiting the family members that come in, so we're minimizing our exposure to COVID. Having that patient have protective face masks prior to surgery, explaining to them that this is what we're going to do to reduce your risk protocol. That's why we want to limit family members, and also making them aware of the fact that we're going to call them not only the day after surgery, but have phone calls every 2 weeks. We want to make sure that the recovery is going well and they don't have any symptoms like a fever or chills that are a symptom of COVID, because if they are, we have to take an intervention because we don't want that patient to have pulmonary complications. We need to go out of our way to impress upon everyone that we're concerned about this and we're doing everything possible to make it safe for people. We're all aware that a huge number of Americans are unemployed, have had their salaries reduced, and they're under economic stress. Many of them have lost their jobs and their insurance, so they don't have the ability to make that same out-of-pocket payment that they might have made in the past. So what we might want to do is to say that if a patient has patient responsibility of $500, maybe we just want them to pay $100 prior to surgery, and then have a payment plan. So we're not letting that out-of-pocket cost deter that patient from proceeding with surgery. We just need to be sensitive to the issues. And obviously we talked about that importance of making sure that we have insurance pre-authorization for that patient in writing. We also have a backlog of surgery for most centers. So there are, I'm not going to go through the chart, but happy to send it to you. There's lots of tools that ASCs are using to forecast what their backlog demand is, how they could accommodate it, and where they need to expand. A lot of ASCs are running later into the evening, not having a cutoff of 3 or 5 o'clock. And certain ASCs are having super Saturdays where a surgeon can maybe get flip rooms and dedicated staff and really work on their backlog, and we can focus on what are the needs of that surgeon, that specialty, and their patients. So lots of advantage to take advantage of these delays to expand our revenue base. It also allows us to capture opportunity from splitters. We might have surgeons using our facilities that work at our facility in a hospital. Patients are reluctant to get care in a hospital now. Surgeons are frustrated with the increased protocols of accommodating surgery. This is an opportunity to say to that splitter, maybe you'd like to increase the number of blocks that you take at our facility every month and do more of your work here. There's lots of surgeons that have been reluctant to go to ASCs. This new environment creates an incentive for them to look at ASCs, and we can talk about their needs and how we're able to meet their needs, how it'll be easier for that surgeon to do it, part of their cases in an ASC, how it'll increase their productivity, their patients will have a better experience, and it gives us the ability to grow our volume and overall share. It also allows us to expand the number of procedures we're doing in our ASC. There's an increase going on of spine and cardiac procedures in an ASC. Prostatectomies are now being done in ASCs with a modified approach. So because of the expansion in approval of procedures that could be done in ASC, again, it creates the opportunity to expand our revenue. And I think it's important to talk about what better performing ASCs are doing is they're not just a freestanding ASC, they're a component of an ambulatory campus with physician offices, imaging, surgery, and therapeutic care afterwards. So it really gives us this opportunity to take advantage of creating an ambulatory campus to further leverage our overall position in a marketplace. This crisis also gives us an opportunity to lower our costs, to talk about with staff that we love you, you've been loyal, but we need some flexibility in terms of how we structure our hours or how we structure our compensation arrangements. Everybody in America has seen a reduction in their salary, and it's an opportunity to talk about these costs. Maybe we increase a staff member's sharing of their health insurance or something like that. It also gives us an opportunity to talk to vendors about the fact that we, like other ASCs in America, have seen a decline in profitability. We want to maintain our relationship. We want to add this new equipment, but we just can't afford it at the price that you're negotiating. A lot of ASCs have been very successful in reducing their leasing costs. A landlord wants to keep you, and they're more than willing to make an accommodation so that you stay with them and they have an ongoing source of revenue. It also gives us an opportunity to standardize our preference cards and to talk to our physicians about the fact that for this procedure, for all surgeons, this is how we're going to do our preference cards and have our supplies. It also allows us to tell our vendors that are supplying disposable equipment or other material, listen, we've been loyal to you, we love your product, but if you don't reduce our price, we've got to consider other vendors. So again, taking advantage of this environment to lower our cost structure and to help make our break-even point lower and more profitable. All of these things are opportunities for ASCs to not only survive in light of COVID, but survive and prosper and further their revenue, further the quality of care that they provide, and improve their financial performance. In order to take advantage of it, we can't cling to our historical ways of doing business. We've got to understand the changes in the healthcare delivery system and adapt to them. We really need to take advantage of this acceleration of the movement from inpatient procedures to ambulatory procedures to procedures done in a freestanding ASC setting. 80% of all procedures in the US are now done on an ambulatory basis, and we really have the ability as an ASC to capture this. And what we really want to do is to create different types of incentives for our staff, so we reward them for the improvements in quality, efficiency, and productivity, which allows us to further prosper as an organization and to help them get a lot of satisfaction out of their profession and what we're contributing. So I just want to thank you. This has been a different way of really communicating, but I think in light of COVID-19, we're going to see more and more virtual communication. If you've got any questions in regards to what I've talked about, please reach out to us or give us a call, and we're happy to help you. Thank you, and have a wonderful day.